All right, I'd like to call the January 22nd, 2019 meeting of the New Canaan Board of Education to order. First up is to approve the minutes from January 7th, 2019. You have a motion? Sherry, second? Hazel, all those in favor? Great, thanks. Any abstentions? Great. Next up is the agenda. There are a few modifications to the agenda. So first would be to move the VEX Robotics team trip action item to number 4 ahead of reports and recognition. The second would be to add 3 donations to the action items. One is an East PTC donation. Second is a South PTC donation, and the third is a Saks donation. Can I have a motion to amend the agenda? Sherry? So moved. Katrina, second. All those in favor? It's unanimous. Thank you. Could I have a motion to approve the revised agenda for this evening? Katrina? Hazel? All those in favor? Thank you. Unanimous. Next is comments from the public. To ensure the public's right to be heard, the board has set aside time during the meeting for public comments. 2 minutes will be allotted to each speaker and a maximum of 15 minutes to each subject. Is there anyone who would like to be heard? Okay, great. So next is an action item for the VEX Robotics team trip. Dr. Lutzy.
Yes, glad to talk about this briefly, and Jim Zambrano's here as well if we have any questions. But just to share that once again, our VEX Robotics team has qualified for the Southern New England Regional Competition, which will take place on March 2nd and 3rd. It's up in Massachusetts. If they do well enough at this event, they can qualify for the World Competition at the end of April, which is in Kentucky. So the VEX Robotics program itself has direct ties to our Project Lead the Way program, which is our engineering program, robotics, and our STEM curriculum. All of these teach 21st century skills that involve engineering and problem solving for our kids. Although the trip's out of state, it is a unique opportunity for our students because they have a chance to compete for the World VEX Robotics competition. For some of the students, the club's been their connection to the high school and will fulfill an opportunity for them to be able to compete on a bigger stage. And in these competitions, they work together with other teams cooperatively. So it's not just the robotics and the competition around that itself, but it's also teamwork, cooperation, competition, other pieces. Mr. Zambrano has coordinated this trip in the past, and he's been working with parents to set up driving arrangements and hotel accommodations as well. Students have agreed to pay their own way. There's a registration fee of $150. The hotel is $180 a night. The registration fee includes lunch, and the students would bring some money for breakfast and dinner. So Mr. Zambrano, who's done the trip before, is here to answer any questions. But as it is a trip out of state, it does require Board of Education approval in order to occur for our students. So.
Thanks, Dr. Lutzy. Any questions? I'd just like to say that, sorry.
No, it's okay. Go ahead. You go ahead.
That the robots were absolutely amazing. The fact that one of them was built in 1 week, it seemed like it was between the hours of maybe 6 o'clock and 2 a.m., but absolutely amazing, and definitely something that I feel like we should support. Deanna?
I was just going to reiterate that, so it's, I don't need to say anything else.
Thank you. Any questions? All right. So with that, can I have a motion to approve the field trip for the VEX Robotics team? Deanna?
So moved.
Sherry, second. All those in favor? Okay. Unanimous. Thank you.
Thank you all for your support. Hopefully we'll see you at Worlds.
Good luck with that.
Next up is reports and recognition. The first on the list is the insurance update with Mr. Spurgeon.
Okay, great. So you should have a handout in front of you, stapled packet. which I'm going to do three things. I'm going to walk you through, or really two things, walk you through claim history, since last fiscal year, as well as get into the initial budget projection. I believe you probably saw in your budget, we had a projection through November. We've now updated that through December with some good news. So, but first, if we can take a look at running claims. This is a sheet we've been using for the last couple of years. This goes back to the 2015 plan year. You will notice a little difference here. I'm tracking the plan year. Your health plan runs the school year, September through August. So sometimes Joanne and I don't exactly match when she shows you her internal services fund things. And that's because I'm tracking how the plan is running over the plan year. So this is actual plan year performance. Mm-hmm. These claims on this sheet are what we call net claims. And what that means is those are claims that are up to the stop loss attachment point. You guys purchase stop loss insurance for any catastrophic claims. Your stop loss insurance kicks in at $300,000. So if any one member of the plan incurs a claim over $300,000, your liability is shut off. So this report here just looks at claims up to your total liability, up to the $300,000. This does include medical, drug, dental, and you have some vision claims in here as well. So it's all the claims. Probably what makes the most sense, I think we've kind of looked at this report in the past, but the way we show it is by month over the running plan year, and then we total at the bottom and then give you an average, which helps us kind of judge the base. I will caution you, when you look at the most recent column, the far right, it looks like we're doing very well in comparison to the average. I'll just state that because we have so many employees enrolled in the HSA plan now, we expect that the first few months of the plan year, our claims will be lower because they haven't hit their deductibles yet. So as the employees haven't hit their deductible, they're paying for their own claim cost. The plan is not paying. So as we start to see folks hit the deductible, we'll expect the claims to increase over the remaining months of the year. And so we usually start to see that happen around month 6, maybe even month 5 a little bit. The other thing I'll caution you about this year, when you look at it compared to the previous year, which is a good news thing, is we moved 170 employees, I believe it was, the non-certified employees and the non-representative employees, to the HSA plan effective September 1. So in the previous column, the 17-18 column, their claims are reflective in the old copay plan. Now they would be reflected under the HSA plan. So the same story, right? Their claims haven't hit the deductibles yet. So we're expecting this year to be a little bit lower as we're kind of watching the claims. But if you look at the totals for September through August for 2015-16, you can see our total claims were just over $11 million and averaged about $925,000 a month. The next year, those kicked up to $12.3 million and averaged a little over $1 million a month. And then for last year, we ended the year at $12 million, almost $9 million, and then slightly over the year before on average, $1.074 million compared to $1.026 million. And then this year, we're running on average $796,000 with the caveats that I stated earlier. Next, we bring in your actual enrollment. So we have two numbers here when we talk about enrollment. We have contracts and members. So a contract is the subscriber on the plan. That's your employee or the retiree who you're obligated to offer coverage to. And a member would include that employee and any of their dependents. So you have 600, and if you look in the last column, 659 employees on the plan. When you count their dependents and include themselves, you have 1,500 people. I'm a family of 4. I'm one contract, but I'm 4 members. Okay, so that's how to look at that. So you can see that you have had a decrease, a slight decrease in your enrollment over the years. So you started at 673 employees. That dropped to 665, then to 660, and about the same right now, 659. So that could be employees who are opting not to have your coverage because they're on a spouse's plan, or it could be changes in your workforce. Membership, same thing. We are seeing some decreases in membership, not significant, but we are seeing that. We do like to track the per capitas, right? So if you have big enrollment shifts, and yours haven't been large enough to really constitute big changes, but if you do have big enrollment shifts, we expect to see claims go down. So we don't want to take credit for having good claim years if it's all because we have fewer employees on the plan. So we do track the per capitas, and you can see right in that first year, the $16,512 was your average claim cost per employee per year. That went up to 18,533, and then 19,543. Again, in our last column here, our annualized number is going to be low because we're expecting that claims are lower than they will end up at the end of the year. And then the same thing for cost per member. We then compare how the plan runs on the per capitas. And so you can see in the 16-17 year, we were about 12% over the previous year, and then we were 5% over last year. So to put that into reference, in the 16-17 year, 12% was probably slightly higher than trend, right? What we would consider the healthcare inflation. So you probably ran a little worse than trend in that year. But then last year we ran better than trend. So plan is running well. The changes that you all make during negotiations are helping the plan, and we'll continue to kind of monitor and make adjustments as necessary. Any questions on that? Yes.
So what, if we were to say, what is trend? What is trend? What would you categorize as trend?
So trend really comprises of a couple different components of it. So right now we're looking at trends around 8%. And what that constitutes is really two main components, so there's several little components within it. One is price, right? So we expect costs to go up year after year, but also there's a change in utilization, right? So as people get older, they utilize more services, so costs could stay the same, and we could still have a positive trend because people are going to utilize more services. And then technology, right? We have more expensive, technologically advanced procedures, they cost more money, they replace a cheaper, older procedure. And that really is what we constitute trends. Trends have, the biggest driver of trends the last few years has been the drug trends, mostly related to specialty drugs. We're starting to see those diminish a little bit. So drug trends, especially because of specialty drugs, have started to come down a little bit. We're seeing some expensive brand name drugs move to generic, which helps. But most of the driving on the reduced drug trend is related to specialty drugs. And a lot of that has to do with some of the competition in the market and the PBMs, the pharmacy benefit managers that are competing for your business. They're really out driving aggressive discounts on the specialty drugs. Okay. The second page in, what we do here is similar to the first, we're tracking claims. I don't show you by month. Instead, I break it into three different components, and really just two components, but three pieces. One is, oh, thanks, that goes on that. The first is how our claims are running.
If you go back to the first and scroll down. Yep. Yep.
Sure.
There you go.
There you go. Oh, just scroll down. Thanks. Yep. That's the one. Yeah. They have it in front of them too. So I break this into two different components. One is looking at how your claims perform against the projection. And then also I look at catastrophic claimants. When we talk about catastrophic claimants, we talk about claimants that have claims for medical and drugs, like I ignore the dental and vision at this point, for medical and drug over $50,000. The reason why we pick that is when you think about your health plan and we negotiate with your unions, or you think about your plan design strategies and wellness programs, we have a very robust wellness committee here. The reason we do those things is to help control the cost of the plan. And those components, what you work on, are great at controlling the cost for the plan. However, when we have catastrophic claimants that are in auto accidents or have chronic conditions, while we can control some of that, it's hard to control. So for example, if you have a claimant that has $150,000 a year in claims, moving them to a higher deductible doesn't really reduce the cost of the plan too much because they're already spending way over their deductible amounts. So we like to track the catastrophic and non-catastrophic. One, catastrophic claimants have a pretty big impact on the cost of the plan for you, but also really by looking at your non-catastrophic claimants, you can tell how well we're controlling the plan. And then when we say controlling the plan, it's plan design and working with our vendor, Cigna currently, to kind of put in different disease management programs and wellness programs. So we have this tracking back all the way to June 2013, 14. The first line, July 2013, 14, the first line shows what Cigna expected your claims to be. And then below that is where your claims actually came in at. You'll notice in the second column, and I can't wait to get rid of it, we have this one 14-month year, and that was the year that you switched over to become a September plan. So the data is a little messy because of that, but it's there. 2 more years, we won't have to worry about it anymore. So what you can see is our expected claims in July 13, 14. At that point, you were a July fiscal year. You were consistent with your fiscal year. Cigna projected claims of $11 million. Your gross claims, so claims including those over the stop-loss attachment point, came in at $10,000,007. Of that, $841,000 was over your stop-loss. So your net claims was just under $10 million. You did better than projection by $1 million or 10%. What we do track here as well is your stop-loss cost. So you have stop-loss, you pay premium for that. Your stop-loss premium in 13-14 was over $500,000, and it was at $300,000 at that point, just like it is today. The next year, our claims were projected to be $13,000,008. They came in higher at $14,000,007. You had less excess claims in that 14-month period of time, about a little less than $60,000. So you were $872,000 over expected that year, or 6%. I do think that's an anomaly year. I think that 14-month year probably wasn't projected, at least at the data that I'm looking at. There was probably some issues with the projection when that was done. So I'm not overly concerned about that 1 year that didn't perform well. Although we do see that in any 1 year, claims can be higher than expected. It's likely that that was more related to the 14-month year than it was to having a really bad year. For September, so in the next one, September 15, we switched to a September plan. Claims were projected to be $13,000,004. Net claims came in at just over $11 million. You were $2.3 million under expected, or 17%. Also note, this is when you started to transition to the HSA plan. So some of this outperforming of projection is related to the fact that your claims were lower than when Cigna did the projection, because you hadn't yet moved to the HSA plan. So some of that is related to just the fact that you negotiated different benefits. September 16, 17, I'll just stick to kind of over-under at this point. You were $168,000 over expected, or 1.39%. That's pretty close when you're talking about a $12 million plan. In 17, 18, we were over a little bit again at $12,000,009. And then this year, we're running $1.3 million under, or about 28%. But again, that's expected to increase as the year goes on and people start to hit their deductibles. One thing that you will note too is on stop loss. So we should note that in 2017-18, we moved from Sun Life, who was your stop loss vendor, and we worked with the town. And so the town and the board are now both with Berkshire for stop loss. That had a net savings for the board and the town. But really what it does is it makes the group a much bigger group, and you're able to share your risk across both populations. That is something that we look at every year. So we'll be looking at stop loss again this year as well. So next we start talking about catastrophic claimants and non-catastrophic claimants. So again, I define a catastrophic claimant as anybody over $50,000. And what I do is I pull down the employer paid, right, your liability for that fiscal year, and then we break up the high dollar claimants and the low dollar claimants. So if we use the first year kind of as a target, then maybe I'll just look at the percentages and the numbers. In the first year, you have $9.9 million in claim liability. Of that, 2.6 was related to high dollar claimants. 7.2 was non-high dollar claimants. Your average member, so here I'm counting the members, not just the employees, was 1,650. Those high dollar claimants, there were 24 of them. So what this tells you is that 27% of your spend in 13-14 was related to a high dollar claimant, and that was 1.5% of your membership. Right, so a very small portion of your membership was driving a fairly large component of your cost. As we move to the right, again, that 14, 15 years, probably a little bit of an anomaly. 33% of your dollars related to about 3% of your membership. And 15, 16, 24% of your dollars on 1.73% of your membership. Then we're down to up to 31.36 on 2.34% of your membership. You may recall we had one very significant large claimant in that year. It was a $1.3 million claimant, which drove a lot of the cost that year. You were only liable for $300,000 of that, so we did get $1 million back in stop loss. But that was the year we had that one very large claimant. 17-18 was similar percentage-wise, 36% and 2.6% of your membership. And again, this last column isn't really very meaningful at this point. And then what I'd like to do in that last line in section 2 is just track our non-high dollar claimants. And so that kind of tells us how is the plan running overall if we take out the impact of the large claimants. And you can see year 14-15 over 13-14, that 18.2. Again, that's my kind of anomaly year. But then we're down to 3.31% increase, 2.28, a decrease in 17-18, and then again, currently we've got an immature year. So the plan is running well. We do have some large claimants that we keep our eye on. We do track that on a monthly basis. Cigna's pretty good about identifying to us when claimants are expected to hit the stop loss, so we can start to watch those claimants. But it is something that we look at. In the bottom, and then I'll lead up to you if you want to go through every line or not, what we do is we just bucket those large claimants within their dollar ranges. So if you look at maybe last year, it'd be a year to look at, the 17-18 year, between 50 and 75, we had 14 people at $852,000. Between 70 and 75,000, we had 6 people at $540,000. Between 100 and 125, we had 7 people at $775,000, and so on down the line. What I think is important to realize there, right, is it doesn't take a lot of members that have catastrophic claims to have a lot of liability for the plan. And that's something that we want to watch as we go along. Questions on that? Okay. So probably what you really want to know.
How to flip over to my other. Oh, there it is. That one, thank you.
So claim projection. I break my claim projections up. What I always do is in the first column, I show you the current budget year. And then from the right over to the right, we start to build out the new projection. You'll see that there's 3 columns: the current budget year, the initial budget projection that we did through November, and then an update through December. We'll be working with Cigna now to do a projection and kind of line our projections up. In general, we're usually pretty close. If we're not, we figure out why we're not, and then we work on our differences. So what's important when I do a projection is the experience period. The experience period is the amount of time that I'm looking at to base my projection. We tend, for groups your size, to always use a 12-month period of time. Many years ago, we used to use 2 years worth of data when claim dollars were a lot smaller. But now that you're a $12 million plan, $13 million plan, your plan is much more predictable, and so we can just look at a 12-month period of time. When we finalized the budget last year, we used claims through November. Claims were $14,615,000. What we then do is any claimant that is over $300,000 or we expect will trend over $300,000, we remove them from the projection altogether. All right, we're going to add them back in later. We don't totally get rid of them. We add them back in later, but we add them back in at your liability. We then create a net paid claims. And what we do is we divide that by your enrollment. So you'll see there in the first column, in the first box, in the first column, the second line from the bottom is 7,973. No, you do not have 7,973 employees. What that is we count them once for every month that they're active in the plan. So it's basically, if you divide that number by 12, that would give you your average enrollment throughout the year. So what that does is that creates our base, right? That creates my per capita. That's going to be my base for a projection. As we go over to the right, you can see that for our 2019-20 projection, claims through November were actually down 12% versus November 17. And again, some of that large claimant, right, from 2 years ago is in that period of time, so that's why those claims were so high. What you'll see is I'm backing out a lot fewer claims, right? I'm not backing out $3 million in claims. I'm only backing out $472,000 in claims. So my net paid claims, even though my gross claims were down 12%, my net paid claims are actually up 8% because I'm removing fewer dollars. You'll see that 0.99 number. That's an adjustment to account for the fact that we had claims incurred by your non-certified staff in this period of time that they were still in the copay plan. So I adjust those claims to reflect what they would look like under the HSA plan. That will actually, if you have me back here, or if you see other sheets of this, that'll eventually go away, because what happens is in the first few months of the year, right, they're not incurring any claims. So at some point, I've got to zero that out, right? I got to give them credit for not incurring any claims at all. So that actually probably by the next month, that adjustment would be gone if we look at it for January. So what we do, we create the per capitas. So our per capita is up 7.79 through November. You'll see that our gross claims through December are down even more. We have a few larger claimants larger dollars to remove, but our net paid claims are up 5.31%. So we're seeing an improvement in our base for our projection. A slight adjustment there, so you can see what's really important for you to understand is we're going from 1547 per capita to 1515. So we're seeing an improvement of a little bit more than 2% in our base for projection. If you flip back to the first page, you can see what happened there and why that happened. If you look at the far right column, the December claims are $795,000. So when we do a running 12 months, right? So every month that we add a new month of experience, I'm dropping off a previous month. Look at the month next to it, right? So I drop $1 million in claims from December 2017, and I'm adding in a lower December 2018. So that's a primary driver of the improvement in the projection. Early indication, looking at January claims, Joanne has some data, is that January looks closer to December than it did to last January. Okay, we still have half a month probably technically to look at, but it looks better than last January. So we create our base. That next box down just talks about the large claimants. We've kind of already reviewed that. What we do here is we just want to track per 12-month cycle the large claimants. Pretty similar in the two most recent columns, right? $4.7 million in November. We're over $50,000 on 41 members, 4.7 on 43 members in the December column. But we are removing that one member that we're removing from the projection was slightly higher in December, which actually helps your projection a little bit too, right? We're taking more out of the projection. Okay, so now I want to do a projection off of that base. So I bring the per capita down, and I bring that as the first line in my projection. So if it's okay, what I'll do is just stick with the December update, and then we can ask if you have questions, we can compare. But I bring the 1577 down. I'm using an 8.57% trend. That's a moderate trend in my opinion. If you look at the bottom, that trend is comprised of an 8% medical and 13% drug. We have been talking to Cigna. Cigna's anticipating a lower trend than that at 7% and 9.4%. It seems a little aggressive, so we've asked them to quantify how they're that low. What I'll tell you is I have other clients. Cigna's consistent with their lower trends, but they're consistently lower than the market, and the market is closer to our moderate assumption than it is to Cigna's projection. Nothing indicates to me that Cigna has an advantage over the market right now, so unless they tell us something different, we might have to stick with the moderate trend assumption. Okay, but I did want to show that Cigna's numbers are a little bit, their trend is a little bit lower. So you see that 8.57, and then below that you see 14.7. And if you look next to the column next to it, you see the same 8.57, but you see 15.5. That's a function of the fact that when I'm doing projections, I'm projecting out for more than a year from now, right? Trend is an annual number. So every time we add a month, I can use a lower trend assumption because I'm converting it to a less, what we call an effective trend, a shorter effective trend period. So the best way to think about that, if trend was 12%, it's roughly 1% a month. If I'm projecting out 21 months, I'd use a 21% trend. If I'm doing 20 months, I use a 20% trend. So every month that we add of experience, if claims stay on average the same, we see some automatic improvement just as I'm trending with a lower trend assumption, okay? So the fact that December claims improved, and I'm also using a lower trend assumption now, is another reason why we're doing better in the December projection versus the November projection. Okay, so I created a new per capita by increasing the 1515 by the trend amount, 14.7%. I then multiply that by your current enrollment, 658 employees. That gives me a new claim number of 13,726,000. But then I have to add back in that large claimant that I pulled out before. I'm not going to add them back in at 524,000 though, because I know that they're only going to be up to your liability of 300,000. So I add them in at your liability of 300,000. That gets you to a claim number of just over $14 million. We then adjust, you'll see there's two adjustments, one's a 1, so it has no impact, but you see a 0.97, so a 3% decrease. That's to reflect the changes, likely changes for the custodians that'll be happening due to negotiations, and also the teacher change and the deductibles. So those will both be happening in September 2019. So those are future benefit adjustments. We then talk about fees. We saw an improvement in the fee assumption. So stop loss, initially we were projecting to be a little over $1 million. I'll admit that's a conservative, that was a conservative assumption based on the fact that claims are running well and some other things I'm seeing in the market. We've revised that down a little bit. I would still say it's conservative, but I think it's a good placeholder. I don't know that I would want to be too much more aggressive on stop loss. The thing about stop loss is you won't lock in our stop loss fees probably until May, which is way past your budget time. So every year that's kind of an issue that we have. We kind of go with what we think it's going to be, and then typically it's improved. Luckily it hasn't gotten worse, but typically stop loss will improve. But we have reduced that a little bit. Sterling is a company you have some services with. They do your FSA plans and some other services, so that's a fee that we include. Your admin fees, so those are the costs for Cigna to manage the plan, to pay their claims, to have access to their network, to provide customer service, all those different things. And then you'll see the drug rebates. So that line has also improved. Initially, we've been projecting a consistent number of about $255,000 per year in drug rebates. What the drug rebates are is we use Cigna to administer your drug plan. Cigna goes out and negotiates contracts with pharmacies and with the drug manufacturers directly. And that includes discounts at the pharmacy as well as actual physical dollar rebates that come back to the plan. We are seeing that the market's getting very competitive, and Cigna is reflecting that, at least in our initial discussions. So we're being optimistic that we'll see an improvement in the RX rebates. Again, I'll state that I think that might be a little bit conservative. We might see this number go up even a little bit higher by the time we finalize negotiations with Cigna. But I think it's a decent placeholder for now. So when you add in all the fees and back out the drug rebates, we're at a number of $14,691,000 in total cost. You've got 658 employees on the plan, so it's an average of $22,327 per employee per year. So the way to look at that is every time you hire an employee, you can expect about $22,000 in expenses on average. And then compared to your budget, it's a favorable number. So we're up about 1.81%. I know my budget was kind of pre some of Joanne's adjustments, so it might not tie exactly back. I think we're a couple $1,000s off here or there. But the budget increase should be fairly tolerable when we're considering a $12 million plan in a trend environment that's much higher, 9%, to end up at a 1.8 total dollar. And a little bit higher on a per employee basis, so we did see a reduction in employees. And I went through that fairly quickly. I think some of you have heard it before, so hopefully it wasn't totally brand new.
Any questions? Deanna?
I just have one question, and maybe a question for Joanne. But when we joint bid the stop loss, how do we allocate the cost for that administration of the stop loss? Like how do we split it, or how do they decide who pays what?
So what they've been doing is we do still have separate rates.
Okay.
And it's built into the rate. The town stop loss is much lower than yours. They're much
Yes.
smaller, so it
Yes.
needs to be. But the town
Aren't they
stop.
at like 100 and,
Yeah, it's-
120, 150? Okay.
I'm thinking 150, but it might be
Yeah.
125.
Yeah.
So theirs is lower, but that's all kind of factored into your premium rates itself.
Okay.
Our expectation is that split proportion, the admin costs of that are split proportionately. When you look at stop loss pricing, it's not like self-funded insurance pricing. We don't specifically see, hey, here's the admin component. What we do is we look at, okay, here's their risk and here's what they're projecting for cost. We kind of compare that to what the market is. So while behind the scenes, their actuaries have a loss expectation and what the admin piece is of it, really what they're doing is they're balancing their whole book of business on what their expected losses are. So it's not a true admin fee component, but it is built into there somehow.
Thank you.
Other questions? Tom?
Just a question about the difference between current contracts and average contracts. Does that account for people that drop out?
Correct. Yeah, so if you had an employee who was on the plan for 6 months of the experience period, and you had an employee that was on the plan for 12 months, you'd have one person at 12, one person at 6, for a total of 18 months, and then you would average that out.
And the projections are based on?
Current, so
Current,
whoever was
correct.
enrolled as of December.
Very good, thank you.
And then the only time we would adjust that is if Joanne says, hey, Joe, we know we're gonna hire new, a considerable amount of new employees, or you're gonna have some other change in employee counts, we might adjust the current to reflect that.
Other questions? I just had a couple. So first, I noticed that on your third page in the 18-19 period, we had, looks like $1.2 billion, $1.2 million of add backs, so for $300,000 stop loss
Correct.
amounts. What's the reason for including just one this year? Is it just because we've only seen one?
Yeah.
And we don't expect any more?
Exactly.
How do you think about projecting that piece?
Yeah, so when your stop loss is this high at 300,000, so your stop loss is high. I think you guys, for those of you who've been on the board for a while, you're aware of that. You have a high liability when it comes to stop loss. When your stop loss is that high, we don't tend to factor in any kind of margin. We kind of say, hey, whatever your past history is going to tell us, the most recent history is going to tell us. If your stop loss was lower and you had a really good year, 2 people that went over stop loss, then we might be a little conservative and say, hey, maybe we should estimate a few more people going over the stop loss. But when you're this big and we have enough history that you're absorbing so much of that liability as it is,
Right.
we think the projection handles it without making any margin adjustments.
Okay, great.
Good question, though.
Thanks. The next one is also related to the town. So I know that there had been some discussions as it relates to administrative fees and possibly, savings associated with admin fees if we were to do things with the town from an administrative perspective. And I think the determination was made with some members on the town side to not pursue that now just because of some changes that are happening, just in the insurance market. Can you talk a little bit about that and how we think about, that as a, potential cost saver down the road?
Yeah, so it's a great question, and we've had a lot of conversations with the town. I expect those will be ongoing, and they're good conversations to have. So first and foremost, one of the issues is you're with Cigna, town's with Anthem. Not that either of you can't change, but there's collective bargaining involved here, right? So it's not as simple as just saying, hey, let's bring all the Anthem people over into our Cigna plan. So that's one part of it, right? There needs to be a process to make that change. That probably hasn't been the main reason why we haven't looked at combining the pools. Rather, what's happening is that the town was initially fully insured. They went self-funded two years ago, I think it was. So when you first start moving into self-funded, I would agree with the town. You probably don't want to be making a lot of changes to the administration of your plan, or you probably want to get a pretty good idea of how your plan's running and have some consistency in that plan. So the likelihood of changing plans probably wasn't good when they were first self-funded. The third piece to look at is when we look at combining pools together, the town is much smaller than you, but still large enough to be what we call credible, right? Their claims dictate their cost. When you're self-funded, your main costs are the claims that are incurred by your employees. So what we're seeing right now is that the market has somewhat, the advantage, the discount advantage of one carrier over another has diminished. And where carriers are really competing, has anybody seen the Cigna commercials lately? When you see a Cigna commercial, they don't talk about being an insurance company, right? They talk about being a healthcare company. And what the insurance company are really doing is they're competing on the services to employers on how they can help make your employees healthy and less on discounts. So when we look at combining two pools, the advantage would be, our claims aren't going to change probably in either one entity, right? So if you're 12 million and the town's 5 million, you're still going to be $17 million, give or take. Combining won't make anybody healthier than not combining. So really what we look at is the impact of the administrative cost, right? So for you, that $500,000. And what would the advantage be of bringing a bigger pool and some economies of scale? Probably a bigger advantage to the town than it would be to you, because you're already a fairly large group. But there could be some advantages on the fixed cost side. But overall, that's a relatively small piece of the overall cost. So when you look at changing vendors, you're really looking at what can you do to control the fixed cost. What I will say is I have clients that look at changing vendors because they want a different partner, right? So we might get to a point where maybe we think there's a better partner out there for us, or we do an RFP and we like the way Anthem is presenting their support services. I found that that's driving more of our changing in carriers now than the overall cost of the plan. Not that people want to pay more, but
Right.
Generally I've seen a couple employers in the past switch for no savings because they really just want to have a different partner. Cigna's done a pretty good job out here. I think they've been a really good partner, and they've really partnered on wellness. But it's definitely something we want to look at. So the last thing to address is, yes, there's a lot of flux in the market right now. I talked a little bit about drug rebates. One of the reasons why our drug rebates are increasing is because we're seeing a lot of competition on the PBM. So PBM stands for Pharmacy Benefit Manager. They're who the insurance carriers go to help negotiate discounts at pharmacies and to negotiate rebate dollars back to the plan. Well, what's happened is Anthem used to use Express Scripts, or still does technically, uses Express Scripts to be their PBM. Cigna had their own, and then CVS owns a PBM called Caremark. In the last 18 months, if you paid attention to the news at all, you know that all three of those names have come up. So Anthem is leaving Express Scripts to start their own PBM. Cigna has bought Express Scripts, and CVS just bought Aetna. So there's a lot of flux in the market right now. So what we decided to do in that meeting with the town was to go back to our respective carriers, to let them know that we know there's a lot of flux and a lot of competition in the market right now, and really put them on point that we need the best deal possible, or we would consider doing a joint RFP on the drug side. I think we're a little concerned about making a change when there's this much kind of merger activity happening in the market. So maybe 2 years down the road, it would make sense to look at, after those mergers are completed, to look at doing an RFP together. Or if something happens in the market that says, no, we should do it now, then we would take advantage of it.
Okay, great, thank you. Yes, Deanna.
I just had two other questions. One is more just for the benefit of the entire board, and if you could talk about, we've asked multiple times if there was any opportunity to lower our aggregate stop loss, our individual stop loss, from 300. We used to be, when I first joined the board, we were, or maybe right before I joined the board, we were closer to like 150, and then there was a decision to kind of move up to 300, and sort of we've, had, a lot of added costs to the board because of that decision, and we've talked to you about trying to, go out to the marketplace to see if there's any opportunity to lose that, lower that, and if you could just kind of the benefit of.
Yeah, so stop loss pricing is based on your attachment point, right? So think of it auto insurance. I mean, it's really not any more complex than that. So the higher your attachment point, consider that your deductible, right? The lower your premiums will be. You're at such a high point, right, that as you start to say, well, if we were to lower from 300 to 250 or to 200, you start to see a fairly sizable increase in premiums. Now, that would likely offset for any liability, though. So one of the analysis that we do is we look at the total cost of your large claimants. And so we'd say, hey, if the stop loss premium is $900,000 for $300,000, but we have all this extra liability, if we drop to $250,000, maybe our premium goes up by $300,000, but we lose $400,000 in liability. So we can do those analysis. What I'll tell you is the stop loss vendors do it too. And so typically, when we kind of have a group where they need to be, unless there's a strong reason, which board's liability could be a strong reason, unless there's a strong reason to make a change, it's typically, you're typically going to pay for it a little bit. And often you're paying for it to help protect your reserves.
And then just the other question, and it kind of goes to a comment you made earlier about changing and collective bargaining issues. You know, the town has sort of police and fire, and you know, if we were looking to combine with a group like that, typically, would you see higher claims in a pool like that? And do we have an issue with you know, premiums for our bargaining units because of the experience of another bargaining unit that we're combining with?
Yeah, so the answer to that is yes, it definitely could. What we're starting to see, though, is that the demographics are changing so much age-wise, and it seems to, so in the past, my experience is, you know, my towns were always older on average than my boards, right? And we're starting to see that switch. I don't have your town's data, so I'm not sure what the case is there. You guys probably have a general idea, right? Look around town hall. But we're starting to see that switch, right? Where teachers are staying on the plans longer. One of the main reasons why is because they pay 100% of their insurance when they retire, and they can't afford to pay 100% of their insurance when they retire, so they're staying on longer to help pay for their insurance. So we're starting to see that the boards are a little bit older. So while you have some of those high-risk professions on the town side, sometimes the age, right? You got a couple 25-year-old, you know, more 25-year-old men on the plan that will reduce your cost. But the answer, so that would be an analysis that you would look at, is what the average cost is. But that's a really good point, is when you merge these two pools together, right? Again, we're not, if the town's 5 million and you're 12 million, you're 17 million. Right? It's not, no one's cost is going to go down for it because of that. What you would discuss is how you absorb that. Most pools would say, hey, for one pool, we're going to blend those numbers together, right? That 17 million is going to be spread across both entities. So unless it just happens to be exact, you'd see some subsidization occurring on one side or the other.
Thank you.
Thanks. Any other questions? All right, thank you.
You're welcome.
Well, I think while we have Joe here, if it's all
Yeah,
right,
great.
I'll ask Joanne to walk us through the other page with insurance, which is a replacement page for your budget book. It's page 80, because this is really the breakdown of, so what Joe just shared with us, sort of how that translates into our budgeting and planning for the 1920 year.
Great.
Dr. Keating?
So historically, we would update our claims as we move through the process. And generally speaking, in the last few years at least, we have not had this significant of a difference in terms of improvement in our claims projections. And so as we took a look at this and started to pull it apart in pieces, we decided that we were comfortable in bringing to the board tonight a revised internal service fund projection with a decreased contribution from the operating budget, which then in effect will decrease our overall budget request from the town. So if you, I'd like to go through the numbers with you, just to point out where we do have differences. So starting with the expenditures, on the first line, claims paid, we had projected that number in our first go-around last time to be $14,057,756. With Joe's revised numbers today, it's $13,605,927. That's a significant difference of $451,829. We also, at the same time, took a look at some of the other numbers that are part of the expenditure equation, and we started with the RX subsidy. I had put in my budget $350,000 credit. I bumped it up from what Joe had in his projection of 255 based on what our history has been over the last few years. I felt that we would achieve that. And the revised number improved upon that by 32,500. And the new budget is a credit of 382,500. And we're certainly going to push our vendor to even approve more on that because we feel that it should be. The HSA contribution for the employer is the same. We do have our renewal now for administrative services from Cigna, and that improved by $9,797. So it went from $508,573 down to $498,776. When it came to stop loss, Joe and I did have somewhat of a different approach to putting the budget together on this, and mine was based on history and what we're currently paying over the last few years. Joe had suggested budgeting at $1,046,146. I dropped that down to $844,800. But after our conversation today, we agreed to put it up, bump that up a bit to $952,564. And the rest of the numbers basically stayed the same. There's a slight change in terms of the ACA taxes. So the net difference on expenditures decrease of $386,129. Now, when we adjust our claims for next year, we also adjust the reserve requirement at the end of June of 2019. So that, in that number, we picked up over 70,000. And when you back these numbers into what our contribution is going to be for the general fund, we're able to decrease that number by $464,319 for a total contribution going from $12,753,845 to $12,289,526. So that is going to help us overall in terms of our budget. So we go from budgeting health insurance or employee benefits increase of 585 to a total increase of 268 percentage-wise. It goes from 5.85 to 2.68. And the overall impact on our budget, it brings it from a 2.55 to a 2.03. And based on the real true improvement for 2 months that we know of, November and December, and where we stand right now with January, we feel comfortable bringing this forward.
It's great. Very good news. People are healthy and the numbers come down.
We love it.
Deanna?
So we didn't ask this when we were looking at the trend, because the trend is pretty remarkable. And I can't help but ask Gary and Joanne and you, because I'm sure you guys look in the claims detail. Do we think that maybe our wellness initiative is helping this? Or, you know, why do we think that this is, I mean, this is pretty remarkable. And you know, I mean, we see many years of data, so it's remarkable over many. So I don't know if anybody has a comment.
I think we'll be able to answer that better in May, right? Because we're going to actually have a meeting with Cigna on
Okay.
that. And I think what I would say is that over the last 14 months is when we really started to push kind of wellness and awareness. So I think we'll get a better idea and then to see, you know, what's kind of driving our improvement. But I mean, I think anecdotally, yes. Right, it's just in everybody's face, and you guys should be very proud of your wellness committee. It is by far the best wellness committee that of all the clients that I work with. They're all engaged, they're eager, they're a little hard to keep up with at 7:30 in the morning because I have to get up at 5 to be here by then. But it's well worth the 2.5 hour drive down. It's really a great committee, so I think yes, and I think we'll see more from that. And Cigna, I mean, they've really done a great job partnering with us on that. They've done a really good job. So I think it's that, but I also think a lot of it is what you've done in negotiations. You know, moving to the consumer-directed health plan, and I know people are concerned about deductibles, but you guys have set the plan right here, right? You're funding a good portion of the deductible for your employees. You've reduced the premium contribution percentage that they pay. So it's not that, you know, bad press HSA where you've given them a $5,000, $10,000 deductible, made them pay half of it, and made them pay half of the premium and don't fund their deductibles. You've done it the right way strategically, and you have to give some credit to your unions too for working with you to come along there. So I think it's a function of all three.
Just to add to that, I do think that we are in the first year with our non-certs. So we are experiencing some of their deductible runoff. We didn't want, so because of that, we did not want to reduce the current year projections on claims because we really don't have a full mature year of that. So we really need to have that experience. And we could see claims go up even further as we get further down the road. It just depends on their spending habits.
But Joe, given your modeling and what have you, the budget numbers as we're bringing them forward here are moderate to conservative?
Yes, moderate.
Moderate.
Moderate, yeah.
We'll take it.
I can do conservative if you need me to.
No.
I like conservative.
No, I like
I'm just
moderate.
kidding. Moderate, yeah, no, I'm very comfortable with a moderate projection here. There's no reason to, we often will give you 2 columns, a moderate and a conservative. and I didn't feel that was even necessary.
Good. Thank you.
Any other questions? Great, thank you.
You're welcome.
So this page can replace the page 80 in your budget binder. And we adjust our overall budget request from the 2.55, it's the superintendent's budget proposal, to the 2.03 overall. We're still at the 1.9 in the non-benefits, and then the 2.03 all-in number.
That's great.
Thank you.
It's an excellent number.
And I was particularly excited to hear Joe say that we had done such an excellent job in negotiations.
Yeah,
Agreed.
It was
agreed.
nice to hear that from an independent source who was there.
It's true. Well, and I do want to share, just again, reiterate the fact, it's a partnership, right? And our, each of the associations has really agreed that as we do this work together, the healthcare is mutually expensive, it's expensive on both sides, and it's beneficial for everybody. So we appreciate being able to work with each of our unions and associations in partnership to try to continue to build sustainability into the plans. We know that it benefits everybody. It's great.
Good. Okay, next on the agenda is the statement of accounts with Dr. Keating.
Okay. This will be quick.
Turn that on. You have before you tonight the December statement of accounts. We're halfway through the fiscal year, 40% through the school year. And again, similar to prior months, our spending is pretty much on track based on previous numbers. We have 51.1% of the budget encumbered at this point in time, and it still represents 73% of salaries. So that allocation of our funding remains consistent. We have $6.7 million still unencumbered, and that does relate to accounts that are not conducive to encumbrances, as we've talked to in the past. The tuition is still at $360,411 over budget at this time. We have informed the town that we would be drawing down the excess cost grant and that we would finalize that once the reforecast is complete. And we also need to get through probably at the end of May before we can go and make those transactions, because other things will change between now and then. And then I did add a comment here. We're currently, with regards to facilities, unexpected repairs in the facility accounts, $79,318 over at this point in time. And we do have some anticipated needs that we'll be adding to this number. We're going to publish the reforecast transfer in February for the January report. Open to any questions.
Any questions? Okay, great, thank you. Next up in action items is the superintendent's budget for a second read. Any discussion? Dr. Lutzy?
Sure. Yeah, just one or two quick things, and glad to answer any questions or provide any information. First, I want to thank the board for the meeting on the 15th, the afternoon of the 15th, with the Resources Committee. I hope that the board felt that that was a beneficial opportunity to ask questions and dig into the budget a little bit more. A few questions have come, and you should have in front of you a packet. It's 4 pages on a table here. And I'm glad to provide any more information or detail around any of the questions that were here. A couple of them it's going to take a little bit more time, unfortunately, to get specific information. Specifically on page 3, it's questions around conferences. Just given the volume of folks that go out on conferences each year. But I did want to make sure the board was aware of the process that we follow around approving conference and travel. First, there's money that's allocated contractually for this. The teachers have $50,000 in their contract. Each administrator has $600 in their contract, and then there's some other money that's put aside for specific initiatives, and we also use grant money as well to fund some professional learning for folks. The process really flows. They're all aligned with our district goals and initiatives. It's the teacher who has approval from a department chair or a curriculum specialist, which then goes to the principals for approval, which ultimately goes to Dr. Krenti and the Assistant Superintendent for Curriculum Instruction for approval for expenditures around the professional learning. So that's all done in advance of a trip or an experience, and then there's either PO is cut or reimbursement is agreed upon. So it's a very strict process that we follow. We have a specific form that we update annually around that, and so there are checks and balances along the way to as we go through and approve those trips. But we'll be glad to pull together more information about this. It's just going to take some time because of the sheer volume of that. There were questions also around the cost for some of the social emotional work that we've been doing. Mark Brackett and some PD opportunities, meetings, and things that we've done. And you'll see that quite a bit of it is grant funded, and then the information or the funding from the budget is included here as well. And you can take a look at that. A couple of other questions, I think we may have touched base on this briefly when we were together. There's a question about the interns line going up 20%. That's an instance where the substitute line is coming down a corresponding amount. So we're anticipating that we can bring in some interns who are college students. They take classes at night, work for us during the day. We pay the college directly, and then that brings down our substitute costs by a corresponding amount. We then have somebody who is a consistent presence in the school, knows the kids, knows the program a lot better than the daily subs are generally able to do. So I think it's a good move for us as a district. Another question around outsourced services, and why are those down to where they are?
Question on that last point, which is, are we able to actually more consistently fill classrooms with an intern as opposed to getting a substitute as a result?
Yeah, so when we hire the interns, they're here every day as they go through the year. The challenge with the interns is finding the right ones, because we really consider it similar to when we hire new staff. So we'll have interview committees that meet with them, and they will really evaluate whether or not we want to hire them in for the year. When we do find the right person, then they do cover as one of our first substitutes for that day, each day. And the expectation is that they're here every day, versus the day-to-day substitutes, which can go unfilled sometimes. Certainly, there are certain times of the year it's more difficult to find daily substitutes. And so having the interns, it can help us to alleviate some of those problems, certainly.
Okay. And one other question, which is, I know this isn't necessarily budget related, but which is, do the interns often come to us full-time after they've graduated?
Sure, great question, because that's one of the strengths of the program, because essentially we get to know them and they get to know us for a full year. And then often we do find people who, if we have an opening, are excellent fits for that, because they've been in the building, they know our kids, they know our district, and we get to, it's a year-long audition often.
Great.
Yeah.
Okay, thanks.
Thank
Sorry
you.
to interrupt.
No, not at all. That's what we're here for. Just the other one I was going to mention briefly was around outsourced services. And I know this is the board making sure we're budgeting sufficiently. And really, there's some real savings there thanks to the insourcing of the document center, the fact that it's an off year for the Turkey Bowl, and the work that we've been doing in our special education program to build internal capacity for many of the services, including the BCBA, which is the Board Certified Behavior Analyst, the professional learning that our staff have done with Wilson Reading, with other programs that we feel are very valuable and important to offer to students. We work to train and do that in-house, and so we're able to bring down outsource services around that a bit. So glad to hit any or talk about anything else here or anything that's not here for the board to further discuss. Again, just to highlight again, our overall budget request at this point is at a 2.03 year-over-year increase. It's 1.90 in everything but the benefits, and then when you put benefits in, it goes up to that 2.03.
That's great. I just have one quick question on something you just mentioned, which is, actually, I'm not sure you mentioned this, but I saw it on here, which is the maintenance project work. Just not really budgeting anything there for this year. Have we moved things over to capital? Do we feel like we've done enough, this school year to address maintenance needs?
So we've really prioritized the high need items this year in our budget to work on that. And the number this year is as high as it is in large part because of the natural gas work that we've been doing in the buildings. So as you'll recall, we've transferred the funding over from the cost of the oil in order to fund that project work. So when you see a significant change there, that's really the big driver in that. But we've also worked to get some of the other projects done that we've identified as either safety or high priority, high need. Things may come up, and if they do, we'll have to sort of figure things out and find a way to fund those. But in bringing the budget forward, we wanted to be as conservative as we could be. And so, we're working this year to try to hit anything that we think is that highest priority or could cause us a problem down the line. Dr. Keating, you're welcome to add, or we can go from there.
Okay, great, thanks. Sherry?
So just to clarify the question on the expense related to the later start time work.
Yes.
So the items that aren't identified with the date, those are the items that are budgeted for the 1920 budget. And previously you mentioned a scheduling consultant. Is that included there?
Sure. So the question was really about current year and past years.
Right.
Right. So in this,
So
the
can you
budget
break out what is
for
current year?
FY20,
Yeah.
we have some funding for a scheduling consultant and some funding for some other transportation work.
Is that what
but
these-
that's not included in here.
That's, okay.
Because that was up till because the question was really up till the present.
Got it.
So in
So
this
these are all
future
prior
budget,
expenses?
yes. Yes,
Okay.
these are existing. And then in the proposed budget, there is funding for some additional work.
And what is the amount in the current budget for,
In the future budget,
in the future budget?
was it
40,000, is that right?
as a total? It sounds right, because we have got the scheduling
That's what I
consultant, the more transportation work for the routing that was in there. And I think we could find that on the why the budget changed page. I can jump to that. Yeah,
It was a total of 45.
good.
So in the 45 is inclusive of all future costs anticipated to get us to a decision point on this?
Actually, it was even to be prepared, should a decision be made, in order to plan forward for implementation in the 2020
Okay,
in the fall of 2020.
okay. Thank you.
Yep. So that's where the scheduling consultant and transportation for the rerouting and other work would be included.
Other questions? Maria?
First, I do want to say I appreciate the, the amount of work you've done and having that extra board meeting in between. But as a process, I really think the board members should come into the process sooner. Asking for questions at the last minute, I think it just puts a lot of pressure on the administration to get answers. I think the discussions, the details, that needs to happen sooner. I know I looked at other districts, they have like 7 meetings. They're like half-day. They really go department by department. I just think that's something I would like to see. Secondly, I wanted to talk about the wellness initiatives. We have it for the staff. We're focused on the social emotional wellness for the students, and it's more psychological wellness. And the more I'm reading up on the impact that not having enough sleep has on student and, growing bodies, the long-term health risks that are, it's in research, the short-term issues, the mood issues. I almost feel like the ruler program will ask students how they're feeling, but they're not at their optimal level of physical ability. Is there a way we can work this, if a solution could be found for the fall, is there a way we can implement something as soon as possible, rather than waiting a whole nother year?
Sure. We've said, and I think it's still it's true today, it really depends upon the magnitude of the change. As we continue to sort of develop and share scenarios and different options and things, if we were talking about a high magnitude change, then we really couldn't, to be frank. The rerouting that it takes, we couldn't do it successfully, right? If it's a lower magnitude change, or if it's a change that is more, less around transportation, more around structure within buildings, let's say, things like that, those things can be implemented. But if we're talking about, say, the most significant change is going from 3 tiers to 2 tiers, right? So if that were ultimately decided to be the best thing to do, it's a months-long process of rerouting all of the students individually and figuring all of that out and being able to do that successfully. So that high magnitude change, we really couldn't do. If it were something more simple around, say, moving everything 15 minutes, but leaving it kind of in the structure that it's in, we could do that, because we're not doing the rerouting, and we would have to look at the schedules and make some changes. But literally, if it was just a matter of pushing everything 15 minutes. So it does depend upon the magnitude of the change. One of the cautions I've heard from districts that have made the change is against sort of making a change one year and then making another change the next year. So sort of doing this and changing everything and then looking forward to another change. And that's backed up by a lot of research that talks about the difficulty of change being more the duration than the intensity. Right? So I agree with that approach, that if you're going to make a change, you sort of do it once and then figure it all out and do that, versus a series of incremental changes over years. But ultimately, I think it's our responsibility to bring forward to the board all of the possible scenarios and take our direction from that. So it's not impossible, but it depends upon the magnitude of the change.
So how do we accelerate the research so we can decide how big the change might be, so we can determine if we can do that?
The research is ongoing. The traffic study that we were talking about, that we received in draft, we're sort of trying to finalize that, but we're going ahead and trying to implement some of those suggestions even this week. Specifically, we're going to have one of our campus monitors out at dismissal here at the high school and over at Saks to see what kind of time we can save by stopping the traffic and allowing the buses out, instead of going with what we have been doing, which is sort of having the buses fight with the traffic as they try. So we believe trying to move those buses out more quickly at the end of the day, both from the high school and Saks, might be able to save us some time, which then would factor into our calculations as we figure out kind of how much time is needed between all of the different waves that we have. Because as you'll recall, as Mark taught us, the start time is really driven by end times, the amount of time it takes for a bus to be loaded, leave the lot, get everybody home, and then get to the next school. Because in the mornings, there's a window that buses can drop students off during, but in the afternoon, they all have to be there at the same time for dismissal. So we believe that having somebody out there to stop the traffic, to get the buses rolling, to get them on their way, instead of having them fighting with the traffic and with the street lights, what have you, we might be able to save some time there. So that would be informative for the board in order to sort of rejigger those scenarios a little bit, capture that time. We may be able to bring forward some proposals that look a little bit different than what you've seen. So that's action research. We have to do it to see what it really results in. And we're starting this week, once midterms are over. And Principal Egan has a letter ready to go tomorrow morning to everyone here at the high school, and we'll do something similar over at Saks to let folks know. We're going to have somebody at the main exit and at the bus exit. And when those buses come and they're lined up ready to go, we're going to stop traffic for maybe 90 seconds. Just to get them out, get them through the corner, and get them on their way, and see what kind of time we can pick up.
And one more point, my daughter made a point, she's a sophomore in college, and she said it's surprising high schools don't run more like colleges. They spend so much less time in class, a lot more latitude in their free time. So my point is, I really think we should consider maybe a different, shorter day for the high school. If that's, it seems like it's high school sports, that's a problem, the end time, that's a problem. You know, I think that's something we need to consider in one of the models, that if you can shorten the high school day, what would it look like?
So we can. We are, of course, constrained by the Connecticut
900
requirements
hours,
around the
right.
900 hours. We're certainly not high in our comparison
I
group.
know in comparison, but we don't have to do
we're not-
everything everyone else does.
No, I know, but we're not that high above 900, to be honest with you. So any change we make, we have to be very sensitive to what that turns into around the instructional time. I will say also, you know, the work that we do with kids in the classroom is our most important work. So as we look at it, certainly, again, all scenarios, happy to look at, entertain, and evaluate any scenario that we bring forward. As superintendent, I think it's a part of my role always to advocate for class time and to protect that time, because I think that is, you know, the work that we do in the instructional core and that interaction between teacher, student, and content is our core mission. That's what we're here for. So, but I understand, you know, all scenarios have to be on the table for evaluation, and I'm glad to look at that too.
Right, I mean, with internships, there must be latitude between teacher, student time, so just,
There is, and that's something for seniors only in that, you know, in that period of time, and that's some, really almost a waiver that the state has allowed if you have a designed program that you go ahead and implement with meeting certain criteria that they give you. Yep.
Okay. Other questions, comments? Sherry?
So, I mean, I'm going to try to focus it on the budget, but just a follow-up question on this, on the later start times. So I would want to repeat the request to have an interim project plan. So I would be interested to know, like, when is that traffic study going to be completed? When is the scheduling study going to be completed? Those are just interim, interim
So-
timeline, I
Yeah.
think would be very helpful for everyone.
Yep.
And then the other thing is, you just kind of introduced some language that I think, if you can clarify, like, what is a significant change versus not significant? So you said a tier 2 would be significant, so, but would, like, the scenario 5 and 6 that have been floated, would those be significant? So,
Sure. So anything that requires significant rerouting of our students is a high magnitude change. The scenario 5 and 6 we've talked about, both of those change the school day and experience for every student in the district. That's a significant change. When we look at making sacks on one dismissal, that's a significant change. It takes the logistics of pulling that together is really, I think it would be a mistake to rush trying to figure that out because it's our students and the experience and everything that suffers if we do and we get it wrong. As far as the project plan, those things go, I've intended to have that ready. I don't have that ready. What I have done this week, I was with the high school and SACs at their PTC meeting. Last week, I was with the elementary folks at their PTC meeting. And these were 2 combined meetings that we had, and the beginning of the conversation was about budget, and some good questions and things came up about that, but then we spent a significant amount of time also talking about school start times. We were here for, I guess, over 90 minutes, I think, and just an open Q&A and conversation about it. The feeling was, you know, that, well, I believe one of the takeaways was the district continues to make significant progress on this. The people rightfully want to see sort of how that all spells out, and that's my responsibility, and I'll have that ready for you soon. The traffic work that we're doing now is a result of the traffic study that was done prior to the holidays. We are looking at the possibility of doing a more comprehensive study as well, simultaneous with this other work that we're doing, which would really give us information about specifics, numbers of cars in and out of the lots during the day, here at the high school, over at Saks, you know, those, putting the strips down in front of the exits, the entrances, and being able to actually count when during the day is the traffic the highest, what are we looking at, how many cars moving through. So we've contacted the police department to see if they had any traffic studies around South and Farm and the intersection. They really didn't have anything that was relevant or current, so they had given us the name of somebody they've used before. And so we've been in touch with that person as well, try to get some pricing around that and try to get an idea if that's something that we can do as well. So we're doing multiple things simultaneously. I do think that in another couple of meetings, certainly we'll be able to have more comprehensive visual type information to share with the board around, where we are, what's happening. I would encourage everyone to go to the website that's up. I do think there's good information there, and I've been looking, people are hearing that. There's 300 to 400 hits a day on the website now, so that's encouraging. And we're trying to just keep that current and keep the information updated there. So as we get a plan together, that's where we're going to share it with folks as well. We'll keep doing that. And the webpage that's up there is right off of our homepage. It's right on the quick links to the left. You can see it. And that has a timeline and a list of different resources and things that for folks who want to learn, including questions such as the surrounding towns, instructional hours, those pieces. Also some of the presentations that you've seen and that we've had shared with us from other folks along the way. So.
Thank you.
Good.
Any questions, comments on the budget? Deanna?
So Jennifer Richardson couldn't be here this evening, but she asked if I would read a statement that she prepared just in advance of a vote on the budget. And she just wanted me to read, it says, "I would like to express my support for the 2019-2020 superintendent's budget. As always, I am so impressed by the amount of work and incredible detail that goes into the budget, putting the budget together. I'm confident that it is aligned with the district goals, demonstrates fiscal responsibility, and will enable us to maintain the level of educational excellence that our kids deserve. New Canaan is a top school district and one that we can and should be proud of. Our schools are the most important asset in New Canaan, and we must continue to invest in our staff, curriculum, technology, and buildings. These are the essential assets of our educational programs and contribute directly to the continued success of our district, but most importantly, to the kids who are our future."
Thank you. Any other questions or comments? Okay, I just had really one, which is, when I first walked through the budget and was looking through the various line items, I was sort of amazed to look at salaries, which we would expect to go up on an annual basis just based on headcount and the collective bargaining agreements that we have. We obviously try to manage that through bargaining. But then you go down the list and contracted services down 4.5%, property services down 8.4%, purchase services up slightly at 1.48%, supplies down 4%, equipment down 21%. Very, very manageable and frankly impressive reductions everywhere else in the budget. There's other objects, which is a very small number, up 1.5%. So I think what this shows is, real focus on cost containment, where we can do that, and still, moving the schools forward and improving consistently year after year. And the other thing I'd highlight is, with some lower numbers in terms of overall enrollment, we actually are reducing our staffing, appropriately, where it makes sense. And we may also have, we've actually budgeted also for, I think, one sort of swing individual possibly, just based on, where at the end of the summer enrollment shakes out in the elementary schools. So, overall, I think it's a great budget that the administration's put together, and I wholeheartedly support it.
Thank you.
Any other questions? Okay. So can I have a motion to approve as a second read the superintendent's budget as first moved and seconded by Ms. West and Ms. Parkhill, respectively, on January 7th?
I think you can just vote.
Okay, sorry. Vote to,
Vote to
sorry about that.
approve. Yeah, it
Vote
should
to
be
approve
vote
the budget.
Favor.
All those in favor? It's unanimous. Thank you.
Thank you. So as we've said before, the budget now shifts to becoming the Board of Education's budget. I will be accompanied by Dr. Keating and Mr. Clark on Thursday as we go to the Board of Selectmen meeting in the morning to share with them an overview of the Board of Education's operating budget and then really focus on the capital requests that we have in here. That meeting, again, is a morning meeting, and it's typically been more almost of a workshop where we're able to just open dialogue with the selectmen, the Board of Selectmen, about the capital requests and the needs. And as you know, we'll be talking about the need to replace the roof over at South first and foremost, but also the other capital requests that are in the budget here. So thank you. Look forward to it.
Sherry?
So I just want to just take a moment to thank Dr. Lutzy for your leadership. I think you took this job knowing there'd never be a dull day. But at the height of budget season, also, leading the way with the later start times, and really doing such a thorough and intensive job on that. I just want to thank you for your leadership.
Thank you.
I think you need to say it out loud a little bit again, what our new budget is, just
Yeah.
so, we sort of like brushed by it in the insurance conversation, but I think we need to like make a bigger,
Yeah,
Well,
I agree.
it's 1.9% excluding
Yes.
benefits, right?
so,
And
but
it's
we go
2
down
point-
from a
Yeah, it's
2.55.
2.03%.
So we went down
Overall.
over 50 basis points.
That's right.
We went down over 50 basis points in this budget from the.
So we would like a
Yes.
local news alert with that headline, please.
How many basis points?
50, over 50,
52 basis
52.
points.
It is, well, and thank you, and I do think it's very important to note. And I want to thank, of course, the team that's been spending so much time working on this, from our principals, our department leaders, our cost center managers, as we call them, whoever, all of the managers across the board, our district administrators, and certainly the cabinet and our finance team, everybody there. We've been working very, very hard on this. It's, as I say from the very beginning, the budget is a lot more than a spreadsheet. Every decision we make it goes beyond just the number you're looking at, and it goes into our consideration of values and beliefs and the goals and what have you. So it takes an awful lot of time and thought, and I want to thank everyone on the team in doing that. And I also want to thank the board, because your input in this from all the way back in that meeting in December with our budget workshop, where we are workshopping ideas and thoughts, and sort of as the budget has evolved along the way, your input has been very important for that too. So very glad to bring it forward, and very proud to represent it from here on out with the town bodies, and certainly will provide an update to the Board of Ed at each of our meetings and along the way. I think that I anticipate that they will be quite pleased with our number of 2.03% as we move forward into these next phases.
I agree.
It was a 2.03.
Yeah. And Brendan.
Thomas guaranteed smooth sailing.
And Brendan.
Yeah,
I was a little like cavalier and about that 52 basis points, but to kind of tag on to what Sherry just said, that didn't come easily. That came over years of negotiating and partnering, and so I know you said that with the insurance comment, but I think it needs to be reiterated that we have really excellent partners in this school district with our teachers and administrators and custodians and secretaries and all the 6 bargaining units. They all have gotten on board, and that 52 basis points came because, I don't know, we'll find out more, but I'm sure a lot of it, as Joe said, was the result of years
That's right.
of partnering. So thank you to everyone. And the town should thank us. Thank them.
Great.
All right. Next up on the list is the 2020-2021 New Canaan Public School calendar for a second read.
Yes. So in the midst of budget and everything else, we have had out there the school calendar for 2020-2021. We like to provide it early when we can, so folks have an opportunity to plan. I'm looking for my copy. Oh, here it is. I got it. Okay. As we mentioned before, you'll see our first day here would be August 31st, which is a Monday, and then the 3 days leading in, 26, 27, 28, would be the staff development days. Convocation on that first day. So this is similar to a calendar we had 8 years ago, where we have the 3 days and then the weekend opportunity for teachers to finalize, get ready for that start to the school year. We do know that having those 3 days before school starts is very beneficial. And in recent negotiations, we've also added a professional learning day for some of our non-certified staff, our teaching assistants. And so having those days in advance is helpful for them as well. Beyond that, happy to answer any questions or go from there.
Any questions?
I'm just curious, to this start on a Monday, this is the first time, as you said, in a long time. How do you think the kindergartners do going full day from day one? What's your experience?
Well, they transition in a little differently than
They
that.
do.
They do. We have an expert.
So they actually, their first day, they're only at school for a very short period of time. They do that transition day with their parents. They come for about an hour. They do an orientation session. And then they move into their full-day session starting on Tuesday. But we certainly take that all into consideration developmentally. They might have extra recess time and break time and things like that to acclimate them to the school.
Thank you.
Thanks. Any other questions? Maria?
It's a 182-day calendar, right, not 180?
Yes.
When did we go from 182? Does anyone know? Because I know there's 2 extra days. I'm thinking ahead to, I know they just had a meeting in the town hall talking about the changes coming, tolls possibly, teacher pensions. I'm just thinking about the cost of having 2 extra days. Is that something, is that?
It is in the contract with teachers. We have had years where we've had to reduce our number of instructional days from 180 down to 181 or 182 to 181 or 180 based on extraordinary weather. If something were to change significantly between now and the implementation of this calendar, then the state requires the 180 days, but a change could always be made if need be, or if the board felt that they wanted to do that.
Or if we had to, I guess I'm thinking economically, if there was something that caused that.
Yep. In the years that we have reduced to 180, teachers have still had 187 days that they did. In districts, because it's 182 plus the 5 professional learning days. And what has happened with our staff is they've changed those, what would have been instructional days, into those professional learning days instead, just as a past practice. Okay.
Ready to approve it, or?
Good. Board's comfortable with it?
Okay. Do we have a motion, or, sorry, all those in favor? Unanimous, thank you.
All right. We'll get it on the website.
All right.
People can make their plans for vacation 2021.
Still learning.
Great.
All right, so next up are 3 PTC donations. The first is East, the second is South, and the last is Saks.
Okay.
Dr. Luxey?
I can speak to these, and Principal Wallach's here as well, if we have any questions over at East. Over at East, they are looking to purchase 4 water bottle fillers. These are similar to what we've purchased in some of the other buildings. The PTC has been working with Principal Wallach, Dan, Clark, John Perna, and they've researched the units, then the locations, what have you. What they'd like to do is coordinate the installation so that it occurs over February break. Which is why it's before you today. They do have some of the work being donated, some of the electrical work and other being donated, but all of it being coordinated through Dan and our facilities team to make sure that it's done appropriately. And of course, we contact the town, we talk with Brian Platts, the building inspector, about it in advance, and follow his guidance as well as we go through that. So I think it's great. It really does help to reduce the number of water bottles that are around.
That's great.
And it's really an important initiative for our district. So.
Any questions?
This is 53, yep. Good.
Yeah, it's for $5,304.12. Can I have a motion to approve that? Deanna, second. Sherry? All those in favor? Great, thanks.
Great. Get it scheduled, Chris.
Next is the South PTC donation.
Yes, and the South PTC is looking to purchase high-interest nonfiction books and high-interest fiction books. They are for the third grade. So there are 6 sets of each that would go in, and it's through classroom libraries. They are leveled, grade level books, and they would go across all of the third grades.
Great. And that's for $11,718. Any questions? Great. All those in favor? Sorry, motion. Katrina, second Tom. All those in favor? Thank you. And last is Saks.
Saks, yes. And the Saks PTC is generously looking to donate sofas and ottomans, which will be placed in 2 separate alcoves just outside the Saks cafeteria. Seating areas will be open to all students, monitored by a staff member who will ensure that the areas are shared equally. The areas will be no food zones and will allow students to read, do homework, play board games, or chat once they're finished eating lunch. The cafeteria can be very noisy on most days, so they hope the areas will give students a place if they want to sit, talk quietly, reflect, play those board games. It's also a way to help develop a sense of community for the kids. They're also going to be used during class periods when the cafeteria is not serving lunch, which will allow the teachers to reserve the areas for group project or for other activities with their students. Principal Gustich is here if we have any questions or anything else, but the PTC has run this by him, and I think all involved believe it's a great addition over at Saks for our kids.
Any questions? That's great. Can I have a motion to approve that donation? Oh, question, Deanna?
I just wanted to make a comment before we vote, because we've had 3 very generous donations today, and if you look in our budget book, there's a page in the back where, and I'm like rifling through, but I saw it earlier, where we talk about the donations that we get in a year from our PTCs and others, and it's actually page 93. For 2018, we got over $400,000 in donations from our parents and community members. And I think it's noteworthy that it really offsets a lot of the things that we do in this community, in the district. And so I just didn't want it to go without being noted.
That's excellent. Thank you, Deanna. Any questions? Okay, can I have a motion to approve the donation? Sherry? Katrina? All those in favor? Thank you. Okay, next is comments from the public. Anyone? Nope, okay. Announcements and future business. Dr. Lutzy.
Sure, our next meeting is February 4th. We will have an update on technology over at Saks and the work that they're doing there, and also some more information about the LMS and the pilot that is just getting underway. Do we have anything else? We'll also have a presentation from the new Canaan Athletic Foundation.
Right.
Leo Carl will be here to share with us some of the work that they've been doing as a group. They've been meeting with the Board of Finance and the Town Council, and Leo has asked to come share with the board some of their best thinking at this time for the enterprise zone encompassing the fields, and which would include Dunning, which of course the Board of Education is very involved with. So Leo will come to share some of that information and get some feedback from the board as well.
Good. Can I have a motion to adjourn? Tom, second? Sherry? All those in favor? Thanks.
Great, thank you.